All right.
All right. Good morning, everyone. Thank you very much for joining us here today. I'm very fortunate to have with me all of the EPA mayors. We've been meeting, as you know, since before the pandemic at the beginning of the year. This group has been meeting, and it's been so helpful to all of us to have gotten together before the pandemic so that we could stay in touch and know how we can help each other and share information through these months. So Mayor Brown from Wilkes-Barre is here, Mayor Cusat from Hazleton is here, Mayor Lombardo from Pittston, and Mayor Coughlin from Nanticoke. I always appreciate your friendship and your leadership. Today we wanted to get together and reinforce what I think everyone is hearing and what everyone knows, but really reinforce that we're at a critical point with COVID in our region. I know it's been, every single day, time after time, whatever news you're looking at, things are about COVID. And I know there's a lot of fatigue out there. But as I've been speaking with the hospitals up here in Lackawanna County, as I've been speaking with the mayors on this call and throughout Pennsylvania and throughout the country, really, we're really hitting a crisis period. This is different now than it was in August and September and October. We really are in a period where we've got to buckle down. We've got to make some sacrifices in order to get through the next few weeks and the next couple months. Hospitalizations are rising along with cases, and we want to make sure that we keep our hospitals in Northeastern Pennsylvania under capacity. So it's really simple. We just can't enforce enough that masks work and that your mask protects others. Your mask also protects you. If you are wearing a mask and you're with somebody who has COVID, the viral load will be less if you're wearing that mask. So not only are you protecting others, but you're protecting yourself. Number two is if you feel sick, stay home. Simple as that. Really, most people are thinking that, I have a cold, I have the flu. Well, you might have COVID. So if you feel sick, please stay home for your safety and the safety of others. And the third piece of this, which is the hardest, and I personally, it's the hardest too, holiday traditions, we're just going to have to sacrifice this year in order to be able to get back to our normal holiday traditions next year. So if you have travel plans, please think through them. Please don't travel if you don't absolutely need to. Please don't invite others to come for the holidays unless you absolutely need to. It's heartbreaking. It really is. And I say that from a personal perspective. It's heartbreaking to say that, but I'd rather that we make these sacrifices now, keep everybody safe and healthy, and then be back hopefully to some semblance of normal next year. So 1, masks. 2, if you feel sick, stay home. And 3, please keep those holiday plans to your immediate family. Utilize Zoom, utilize any sort of communications remotely that you can and plan in these coming weeks, just to get through this as a community, get through this as a region, and come out the other side in early 2021 safe and healthy. So with that, Mayor Brown, take it away.
Well said, Mayor. Thank you very much. A couple of things I did want to relate to the audience. We did install some safety protocols as of today at City Hall. And believe it or not, I've actually received a couple of negative phone calls because of it. But my intent is to ensure that the people that work at City Hall, the people that visit City Hall are being as safe as possible. We're taking temperature checks, we're doing background questions and other things. And then we're also having entrance identified and an exit identified. And we're limiting the people to the first floor. Now, what that means is if someone wants to come to the mayor's office and talk to me, they can still do that, but they'll be directed individually to my office or the other offices on the 2nd, 3rd, and 4th floors. So we're not shutting down the offices. It's just that we're controlling more of the flow rather than letting people just randomly go in the elevator and go to the 2nd, 3rd, and 4th floors. Also, we want to protect the residents as they come in. And it's very important that, as Mayor Cognetti said, make sure that you're wearing a mask or you will not be allowed to come into City Hall. We make sure that we check your temperature. So please work with these precautions. But we started today And we're going to keep enforcing that. We're hoping that the fallout from the Thanksgiving holidays does not increase the number of cases. It's something I'm really concerned about, and I'm sure every other mayor on this call is concerned about that also. We're lucky in Wilkes-Barre City. We have a health department, one of 10 in the state. So I get the numbers and I see where the cases are coming from, and we're asking people, please social distance and take care of the proper CDC requirements that you should be. Use hand sanitizer, cleanse your hands, wear the masks. So that's something I think that we have to collectively work together on as a team of mayors that represents probably a couple 100,000 people. And it's growing, I believe. So we are looking at naturally trying to promote the city of Wilkes-Barre, but we're going to do it in a safe way. If it's not safe, I don't want to do the things that we have on plans. Secondly, I wanted to talk about, if you don't mind, Mayor, is about the lack of revenue that we've received. I say lack of revenue from the federal government. City of Wilkes-Barre, we've had $4 to $4.5 million in lost revenue. And I'm sure Mayor Cognetti, you probably have more than that. And Mayor Lombardo, Mayor Cusat, and Mayor Coughlin, probably the same thing. We have to try to stress the fact that with the new leadership in Washington, that we need some type of financial assistance to make up for the revenue loss. And if combining together this team of mayors makes it even more powerful, I'm all for that. But we have to help each other out to try to secure, the lost revenue that we've had. So there are 2 points that I want to pass on to the audience is, first of all, safety. And we are imposing the restrictions in the city. The fire department has restrictions, police department, DPW, and City Hall. And secondly, a plea from the group of mayors that's here today that we need help in securing some monies from the federal government to help us with the lost revenue.
Excellent. Mayor Brown, you were supposed to pick the next victim.
Oh, I was.
Well, I'll go
I
if
must
you
have
want,
missed
Mayor.
that part of our meeting. I'm going to pass it on now to the dynamic Mayor Jeff Cusat.
Oh,
I don't know if I was ever called dynamic before, but right now, my city hall is still opened. We are limiting people to visit each office with the direct contact appointments. But every one of our employees has their own office. So we're kind of in a situation where I feel everybody's safe once they get in the building. We don't have a lot of those separate offices like you do in Wilkes-Barre, Scranton. So we're pretty well safe here inside City Hall. The important thing is people in the last 8-9 months have learned safety precautions, and that's what they need to keep practicing. Try to live your life as much as you can. However, just use the precautions that you've learned and have become, normality lately. But, I really don't got much. I mean, everything's kind of been said, You guys say it all nicely. I'm more of a mumbler. So.
You always say it. You always say it well, Mayor, and we appreciate it. I think it's really important that we're all on these calls, because if you think about all the way from Lackawanna County all the way down to South Luzerne County with you and Hazleton, it like Mayor Brown said, it's a lot of people. It's over 500,000 people. It's a lot of people that we need to do everything we can to help protect. Mayor Coughlin.
thank you, Mayor. And we're a little bit different down in Nanticoke here. Our building is closed to the public. They still could come to the door if they have to pay a bill or whatever. Our employees can see, but we're pretty well open. And plus the fact we have our magistrate's office that's in our building too, which they've shut down. So what we're doing, because of what we feel might get worse until the end of this year, is keep our building closed to the public. They still could call, they could still come to the door, we could still service them. It's just, again, we just want to be proactive as far as being safe and to our employees and to the public. Before, like we were talking before, a couple of the mayors, before you might not have known anyone who, was tested or had the virus. Now, I think today, everyone knows at least one person that either had it or went for a test. And it's just getting worse. And we're just trying to, be safe down here, where we keep telling the employees, mask, wear the mask. The masks work. Please wear your mask. And again, just echoing what Mayor Brown says as far as funding. Us as a group, we feel that, direct funding should come right to the cities. So because we know what we need to do with the money. So that's about all I have. Just, everything else that everybody says, but please, everyone stay safe. Wear your mask. Thank you.
That's it. Mayor Lombardo.
Thank you. I would just reiterate what all of you have said. Mayor Cognetti, thank you for the opportunity to participate in this and for organizing this and getting us together. And, that's an interesting word, together. I mean, that's how we've gotten this far. But in the same sentence, we use the word apart. So we can work together, but I think we need to be smart and keep our distance, exercise social distance. I can't emphasize enough the importance of the mask. Here in the city, we've restricted movement about City Hall. We're still open, but again, it's mandatory masks in City Hall. It's mandatory to enter into our public buildings. Please do that. I know it's not the easiest thing all the time, but it is the safest thing, and it is a smart thing. And I believe it's been a long couple months, and this has been to call it a marathon is probably an underrepresentation of what it is. But for all of you that will follow the running analogy out there, the hardest part of the race sometimes is the end. But I think the end is in sight, and I think we've made a lot of strides. The medical field has made a lot of strides. We're hearing that the vaccines are out there on the horizon. The medical field has gotten better in terms of their reaction and understanding this disease. So there has been some progress, and I think there's some optimism in the air, even though right now, we're having a bit of a spike. I think we can get through this. But I do want to say globally that I want to commend everybody in all of our municipalities and both of our counties. I think everybody has worked very hard and has done their best. We just need to make a little more sacrifice. And it comes at a time of year where it's hard, because I think all of us, particularly the older we get, the importance for, the holiday, the Christmas holiday for me is not what you get or what you give, it's who you're around. So to take that away is worse than losing the best gift. But I think it's a gift that's important, and it's a gift that will allow us to get into next year. And I really believe that if we buckle down over the next 4 months, we can get to the next place, and 2021 will be a much better year. So thank you again, everybody, for working hard. And thank you to the mayors for doing the jobs that they're doing, and being supportive. And thanks for this opportunity to speak.
Thank you, Mayor. I spoke with one of the doctors I speak with very frequently this morning, and he said, Mayor, it's always darkest before dawn. I said I was going to say this on this call because the vaccine is coming. The science has worked. They've worked so hard. All the scientists, all the medical professionals around the world have worked so hard. It's coming, but the vaccine isn't going to come before this next set of weeks and months. So it's really a tough period, but we can get through it. The end is in sight. But I would let Mayor Lombardo finish off any of the running analogies. But we gotta sprint to the finish, and this is a tough stretch ahead of us before we get to that finish line. So with that, I'm happy to open it up to any questions that you have.
I have a question.
Hi, Chelsea.
Hi.
Hi, Chelsea.
Paige, we've never met in person. Hi, how are you? I was wondering if you guys are privy to any information. Each of you has said in our city halls, in our communities, we are asking people to wear masks. We do have this hand sanitizer available. We're doing all these mitigation tactics. Is there anything that you guys are seeing that, you can kind of pinpoint, like, this might be what's causing this current spike, or this might be what's causing the current spike, especially in maybe places like nursing homes or things like that?
So in terms of causation, I can't speak to that. I would say the impetus for this call today is looking at the data up here in Lackawanna County on my end, and looking at Scranton, looking at the hospitalizations. The hospitalizations have really, really increased over the last couple of weeks. And so that's, you can get cases that are high, and we saw high case rates in September, October, but the hospitalizations stayed nice and low. Those hospitalizations now have ticked up, and that's a concern of the hospitals here. We have our task force call here locally with the hospitals, and they're concerned about the hospitalization levels as well. So it's really important that we continue to get this message out about masking, staying home if you're sick, modifying those holiday plans, because we want to make sure that we keep those hospitals under capacity.
And Chelsea, if I could add just a few things, I'm concerned about the fact that people got together over the Thanksgiving holiday and they relaxed the things that we're asking them to do. I know families got together and people came in from out of town, out of state, whatever. You can't let these things just be forgotten because it's a holiday. You have to make sure you still practice the things that we're asking people to do. And my concern is that there may be a spike in a week or two as an effect of people getting together over the Thanksgiving holidays. They party and other things, and they get more relaxed. So I'm waiting to see if there's going to be a direct relationship to the Thanksgiving holiday. And if there is, there's probably going to be the same thing happening over the Christmas and New Year's holidays. So it's a concern for me, and we'll just have to wait and see.
Yeah, and I think, that for a lot of people, I think fatigue with this disease is certainly setting in this virus, and that, we're frustrated. It's been a bunch of months where we've been, knocked out of the ordinary, so to speak. And I think, you have some people that are grasping to get back to where we were. And I think that there's some optimism in the air, but that optimism doesn't mean that we should stop doing what we're doing. I think it means that now more than ever, we need to buckle down and do it even more so that the medicine and the science part of it, excuse me, as Mayor Cognetti said, can do what it needs to do. And, as far as the spread goes, I mean, obviously, the more people that get it, the more potential there is for spreading it. So we really need to stop it now. And, who knows what the science is going to say a year or two from now. We all know the idea of flu season. We may be in what later gets identified as a season that, makes this more viable to move about. Who knows? I don't understand that science part of it. But again, I think the message is we can get there by doing the things we're doing. And I would urge everybody to make smart choices. We're not saying don't do the things you have to do, but don't, lighten up. Make good choices, try to restrict, and ask yourself, do I really need to do this? Do I really need to go out and get whatever, or do I really need to travel? The future is what's at stake here, not the next 4 weeks.
Good morning, mayors. How are you? Good to see you.
Good. Hi, Andy.
Good to see and hear all of you. Saw the Mayor Brown this morning, the Solomon Creek flood restoration project there. Quick question, folks. I've covered several of your meetings over the last several months when you were able to do it in person. What collectively have you done so far, or do you plan to do, whether penning a letter or an email or some kind of a group effort to reach out to federal and state lawmakers as a collective body? And as you said, Mayor Brown, several 100,000 people carries a lot of weight. Have you done that yet, or is that a work in progress to get help financially and whatever you need for to deal with this COVID-19? I'll leave it out there for anybody who can answer.
Well, if I could jump in on that, I mean, one of the things that we've been doing, and I can speak to it because I'm a member of the executive board through the Pennsylvania Municipal League, which not only then ties all of us in as local mayors, but it ties in numerous municipalities across the Commonwealth. And then there's also a link to the National League of Cities. We've been talking to the policy boards in each of those entities and talking about getting the message together. And as Mayor Cognetti and Mayor Brown said earlier, that, that there's strength in numbers and us joining and sharing our stories and seeing that there's consistency in terms of what the impact has been and what help has been. So that's one of the things we've done. And I think, the other things, we've all certainly reached out to our legislative officials, be it on the state and local level, and conveyed some of the messages and data and results in terms of, this is what the real impact is now. And we're in the last quarter of the year, so it's not speculation now. We've got raw data and numbers to talk about budget impact. So, from an initial, that's what I would say. We've used some of those more global entities. And Andy, I could tell you the stories we're hearing from all across the state, be it Altoona or Pittsburgh or Philadelphia or Easton, Lancaster. They're all sharing similar stories to us. The magnitude of impact is just driven again by how large or small we are as a given municipality. So I think the voice is all speaking the same language. We just need to keep doing it. And I know I have another meeting next week with the Pennsylvania Municipal League regarding this matter, and we're going to continue to convey this message. And I know that the other mayors on the phone and on this call, have also participated in that entity. So that is one of the things that we've done.
Thank you, Mayor.
I think
You're welcome.
timing is important too. That, as we know, that the Senate was on recess for the election leading up to November, and the current session it doesn't seem like there's going to be much coming out in the next few weeks. So I think our group will work alongside PML and our other mayors and decide what does that communication look like? What does that ramped up communication look like maybe in January when there's a new Senate session?
Great. Thank you.
Mayor, it's David Singleton with the Times Tribune.
Hi, David.
How you doing?
Good.
We received a report in the newsroom that you're under quarantine. Can you address that?
Yeah. So late Sunday, I got a call from someone who's a member of their household tested positive for COVID. I had been with that person last week for a meeting. So I decided that I should stay home until that person's test comes back. So I've been home working from home all week, and we all take this very, very seriously. I go beyond the CDC guidelines for these things because I want to make sure that I'm leading by example and not endangering anyone. So I've been doing everything remotely. And as we're speaking, it's been a great opportunity to be on here. I'm actually missing a dedication for the NeighborWorks Luzerne Street project, which is unfortunate, but that's the year that we're having, and we'll keep working from home. As you guys know, this is the nursery, so behind me is a bunch of baby books, and it's very glamorous. It's a very glamorous set. Anything else? We can. All right. Well, thank you all very, very much. Again, to my mayor colleagues, I wouldn't be able to do this without you. Just knowing that you're there, just a text message away is really helpful, especially as it's still my first year, and Mayor Brown, still your first year. Hard to believe. Really hard to believe, but I appreciate all of you and everyone from the media. I appreciate you continuing to cover all of this and continuing to help the community understand what's going on. We wouldn't be able to do what we're doing without you. So thank you for that. So we'll see you guys soon, and stay safe.
Thanks, Mayor. Stay safe.
Thank you. Everyone stay safe.
Take care, everybody. Again, thanks for always being available. Thanks, guys. Take care.
Thank you.
You're welcome.
Thank you.
Thank you.